And now I'm really excited to introduce our panelists to you. So Jose, if you wouldn't mind, perfect timing. I'm going to tell you a little about these good folks before we dive in. I'm going to start with a fellow on the right-hand side of your screen. So that is Jono K. Jono is a queer designer working at the intersection of digital media and social change. The majority of his career has focused on using technology to address systemic inequalities faced by marginalized youth. Today, he is the co-founder and executive director of SameSame, a nonprofit leveraging digital technologies to support LGBTQI+ youth mental health in challenging environments. Previously, as Chief Creative and Programs Officer for Girl Effect, he led global teams creating digital platforms that empowered millions of girls and young women worldwide, particularly in regions where gender inequality limits access to essential information and support. A South African social entrepreneur, Jono specializes in developing inclusive digital solutions that overcome barriers faced by underserved communities. His projects have reached over 40 million people across 40 countries. Did I get that all right, Jono? Was it everything? Did I miss anything important?
No, not at all. All good.
Awesome. Great. All right, the next person I would like to introduce is Derrick Matthews. Dr. Derrick Matthews is the Director of Research Science at the Trevor Project. He's a social and behavioral public health scientist whose work focuses on enhancing research methods with lived experiences of people and communities, especially as it relates to intersectionality and its consequences for health. His research areas include LGBTQ+ mental health, racial inequities in the US HIV epidemic among sexual minority men, and ways to thoughtfully operationalize identity and discrimination in health equity research. He completed his PhD in health behavior at UNC, an MPH in health behavior and health education at the University of Michigan, and a BA in English from Rice University. Dr. Matthews also received postdoctoral training in HIV-related health disparities at the University of Pittsburgh and a training fellowship in LGBTQ+ population health from the Fenway Institute. Was that everything, Derrick? Anything else we should mention?
I think I'm good. Thank you.
Thank you. Good, good. And last but in no way least, my boss and the founder of the Eidos LGBTQ Health Initiative, Dr. Jose Bauermeister. He is the founding faculty director of Eidos LGBTQ Health Initiative at the University of Pennsylvania. His work focuses on synergizing systems-level interventions, community engagement, digital strategies, and clinical innovations to optimize the health and well-being of LGBTQ+ communities. Jose has led projects funded by the NIH, CDC, Ford Foundation, MAC AIDS Fund, Hope Lab, and the Herbert Foundation. He's published over 250 peer-reviewed publications, and he's also Penn's Albert M. Greenfield University Professor of Human Relations and Psychiatry at the Perelman School of Medicine. Jose is an Aspen Institute Health Innovators Fellow and a member of the Aspen Global Leadership Network. Jose, was that everything?
And more. For the record, you're my boss most days.
I love that you say that and think that. This is great news.
And it's recorded.
Yeah, for posterity. So usually this is the part in the conversation where I would tell the folks a little bit about Eidos, but since Jose, this is your project you founded, I've invited Jose to share a little bit about Eidos and our mission, and also give us some kind of introductory orienting remarks about digital interventions for mental health, which is the topic that brings us together today. So I'm going to pass things over to Jose for a couple minutes.
Thanks, Kevin. Hi, everyone. Welcome. It's my pleasure to bring us together today to talk about how Eidos is leveraging digital solutions to address the mental health needs of LGBTQ+ communities. For those of you who are unfamiliar with our work, we operate at the intersection of community, academia, and business with the mission of creating innovative, action-oriented solutions that improve LGBTQ health. And you've already met Kevin, so if you're interested in working with us, send him a note. He's always happy to connect. So I think it's important more than ever to situate why this work is crucial. The state of LGBTQ+ health in the US and globally is a stark reminder of the inequities we face. Based on the data that we have currently, about 7% of Americans identify as LGBTQ+, with some disparities by generations noted. Actually, quite a number of younger generations report as LGBTQ+, with Gen Z leading the way with nearly 20% identifying as a member of our communities. But along with the increased visibility comes increased vulnerability, and many in our community continue to experience discrimination in healthcare, with 16% reporting outright denial of care, and 27% of our trans brothers, sisters, and others experiencing this specifically because of their gender identity. These barriers contribute to disparities in health outcomes, social outcomes, and include higher rates of cancer, cardiovascular disease, mental health challenges, and victimization. In an era of rapid technological change, we actually have looked to technology to help us address some of these inequities. Today, we'll be talking about digital tools and technologies that hold promise to transform healthcare access and delivery. And there are incredible opportunities through telemedicine, real-time symptom tracking, personalized healthcare record access, and even virtual consultations. Alongside clinical care, these digital platforms also allow us to deepen our community engagement. We can advocate, educate, and provide support to one another in ways that were unimaginable even a few years ago. These tools can help bridge geographic and social divides and help us enable care in settings that may otherwise be inaccessible. Now, this is probably my favorite slide, and shout out to Marley in our team for putting it together. LGBTQ plus people have always been innovators. We find ways to create resources and support systems when traditional options have fallen short. And so before we look to the future today, I think it's important that we take stock of queer people's resourcefulness and their historic ability to leverage technology to meet our community's needs. For example, in 1972, the Gay Switchboard was a confidential phone hotline that provided queer people with queer-friendly resources. In 1988, some of you will remember BBS, or Bulletin Board System, where you could dial up to local and national networks and have access to forums, chat rooms, and spaces for organizing. In 1989, we had the Critical Path AIDS Project, which was a newsletter that distributed information about HIV, which eventually became a treatment hotline, a pager system, and later on an information web directory. And of course, we were among the first in our community to think about online dating with systems as early as 1999 with gay.com, which went live on the World Wide Web as one of the earliest online dating sites ever. And so whether it be behavior change interventions to social support networks, our communities have advanced the use of technology to create spaces where queer people can connect and thrive. And while digital interventions can broaden our reach, they're not a cure-all. There are still access to inequities, which we have to address, particularly for people living in rural or socioeconomically disadvantaged communities. I also want to recognize that data privacy continues to be a concern, especially when queer identities can be sensitive information and may feel unsafe to share. And of course, technology alone cannot replace the human touch that we all receive in care delivery. Now, what gives me hope is the approach that we've embraced at Eidos, as well as by the partners who are on this call today. And so by blending the expertise of academics, the lived experience of our community members, and the potential scale of these digital technologies, I think we're well poised to co-create interventions that are not just innovative, but impactful. So as we look ahead and have this conversation, I urge us all to think about how we can harness these technologies to build a future where no LGBTQ plus individual is left behind. And it's not just about closing gaps in care, it's about creating a healthcare system that sees us, that values us, and meets us where we are. I really thank you for your time and for being part of this critical conversation. I'm going to pass the mic back to Kevin so that he can guide us through the remainder of this connecting conversation. Kevin?
Yes, thank you so much, Jose. I appreciate that. So I introduced the panelists a moment earlier, but now I want to give them a chance to tell you a little bit more about their own backgrounds, their expertise, and sort of talk about some of the issues that Jose brought up. I'm going to start with you, Derrick, because as I recall, you used to teach with Jose back in the day.
I know, he was my TA as a student. So this was a long time ago.
Well, hopefully it was like nice familiarity and nostalgia to see him presenting to a group again. So I was hoping you could tell us just a little bit about your work with the Trevor Project and what are some of the areas that you're currently investigating there?
Yeah, happy to. So for those who may not be familiar with the Trevor Project, so we're the leading suicide prevention and crisis intervention service for LGBTQ plus young people. And so as the director of research science, my role primarily falls on the kind of prevention side of the organization. And really our goal there is to use several different sources of data to better understand the mental health and needs and suicide thoughts and behaviors of LGBTQ plus young people. And so I'd say the data source that we're probably the best known for right now is our US National Survey on the mental health of LGBTQ plus young people. And so our 2024 version has nearly, 20,000 folks who've responded. So, we have a really nice opportunity to learn a lot there. And we also ask questions related to kind of healthcare, social determinants, and really just as many kind of different aspects as we can related to the lived experiences of these young folks. And we're going to actually be launching the next iteration of this survey next spring. And so that's really exciting. And also exciting is that we're actually going to only be doing this every other year. And while that sounds like, oh no, it's actually so we can kind of give us space to kind of diversify the types of work that we're doing. So one, we're about halfway through a longitudinal study. And so we're really excited to be able to provide some more causal evidence for the relationships that we see. And it wasn't, designed with this in mind, but I think what I will for now generously call a social and policy shift, really being able to kind of see prospectively kind of what this will mean for kind of the development of these young people will be really important. And I'm also really excited that we're going to be starting two qualitative studies, right? And so one will be specifically focused on the healthcare experiences of transgender and non-binary young people and how they navigate these systems. And the second is really focused on kind of LGBTQ plus young people and kind of the whole family ecosystem. And what does that mean to have supportive or unfortunately non-supportive kind of parents and caregivers? And so, a lot of these will take a little bit of time to bear fruit, but, we're still learning a lot again from the 2024 survey. Just yesterday, we released a research brief with the Movement Advancement Project. So that was really fun partnering with them. And really just, we're able to show that state policies matter, right? Kind of folks were doing better kind of when states had kind of more favorable policy indices. And, we can talk about that later, kind of the role of states in this sort of national context right now. But yeah, so we got a lot going on, diversifying our research. Yeah, I'm excited to talk more about that.
That's amazing. It sounds like you're very busy over there. And for anyone on this call who is not referred to the Trevor Project data, the best reports, whenever I'm doing any sort of presentation, whenever I'm talking about LGBTQ folks in general, but especially youth, obviously, I'm constantly referring to your website. So talking to you today is a little bit like peeking behind the curtain. I really appreciate it. One thing I will actually talk about from the 2024 report is one of the findings there was that young people are more likely to find affirming spaces online than in real life, in their homes, schools, or in community events. They also said on that survey that they're more likely to find an older LGBTQ role model on social media or online than in real life. I'm curious what that suggests to you about the role of digital interventions for mental health.
Yeah, I think it's really interesting and telling. And, I think this is often the case with quantitative data, right? It tends to point to like the beginning of a story, not so much the kind of definitive answer. And so in some ways, I'm not surprised, right? I think the fact that we found so many folks who found online spaces affirming is largely just because, the internet's a big place, and we can sort of, right, self-select into spaces online. And I know that often gets the sort of bad rap when we talk about kind of like echo chambers and information bubbles and things like that. But I think it's actually really a good thing and very important, right? If you're a member of a marginalized group, like finding other folks can be, could be important and literally life-saving. And so, we've done a little bit of work to understand kind of like where folks are kind of accessing supportive spaces online, and we're going to be doing more of that. And I think, preliminarily, what I think is interesting is that folks are all over the place, right? Some folks are finding comfort in Instagram, others like, TikTok, and then others are talking about, right, more LGBTQ specific spaces like Trevor Space. Interestingly, we've seen a lot of people identify like video game related spaces as kind of really affirming, and as a like fellow nerd, that's always kind of heartwarming. But I think for me, the takeaway is that like these spaces are diverse and important and very different. And they're likely fulfilling different needs for different people. And so I think in terms of interventions, we have to really get a handle on, okay, these are probably meeting a lot of different needs. So what are we doing, right? So if we have a kind of one size fits all approach, we're going to be leaving a lot of people behind. in terms of the role model thing, I think that's a little bit more complicated. Right, I think we know from a lot of research that especially older role models like be really good for kind of well-being and mental health. But there's also a kind of distinction between what's called like accessible and inaccessible role models. And unfortunately, a lot of the folks online tend to be like inaccessible role models, right? Like, I know you on social media, but like I don't know you, right?
Exactly.
And so they may not really carry a lot of the same benefits. And actually, some studies have shown they may actually be more associated with kind of like more psychological distress. And so I don't think it's a causal relationship, but I do think it means we have to think about the context in which folks are kind of seeking out role models online. And so, I believe in the sort of potential and promise of kind of leveraging digital interventions to facilitate those relationships. But I think we still haven't exactly figured out what does it mean to do that in this space, right? I don't think inaccessible and online are synonymous, but I think we have to be really careful and thoughtful around how do we create accessible role models in a space, right, where folks don't actually kind of know each other yet. So.
No, very interesting. And I actually want to pull out something that you mentioned a few times now, and I'll let you speak more about it, is you've kind of talked about how multiple sources of data are needed, how quantitative is also just the beginning of a story. So I'm curious for you as a researcher, how do you address the challenge of kind of integrating quantitative data with lived experience to kind of create that fuller view and tell a fuller story to people with the data you're collecting?
Yeah, when I have the answer, I'll let you know. Yeah, I mean, I think the first thing, we have to keep iterating, right? Like, every survey is better than well, should be better than the last one. So we know that online spaces are affirming, for example. So again, like, where are they? Like, what are the aspects people find affirming? What drives people to one space and not another? And so I think we have to figure that out, and that often means, right, we have to just privilege, I think, qualitative research a lot more than we do in this process. And also, it's not like a rocket science. We need to just like talk to the young people that we serve. Um, which often is easier said than done. We've recently just started our own kind of youth advisory councils at Trevor, and like even in that short time, it's made a very like positive impact on kind of the way we've already been thinking about some of our upcoming activities. Um, and I think it's also really important because we have to think about like the outcomes that we're kind of interested in, right? So I think we often, as researchers, know what outcomes we're interested in, and we know what our grant funders are often interested in. Um, but we could be missing the mark kind of entirely, and so it's really important that we also, um, integrate and understand what folks are saying, at that kind of really basic level of when we're designing our research or intervention. So, we may have a really great intervention that we think failed, but actually was meeting some really important needs that we weren't sort of thoughtful enough to ask about. So, I think that just means we've got to sort of shift the power balance a little bit more in the hands of kind of the communities for whom the interventions are supposed to be working, which, is always challenging for us, especially. Um, but I think that's really what we're going to have to do.
No, it's amazing to hear. And it's also liberating for me to hear that as much great work as I see the Trevor Project doing to recognize there's always iterations, there's always more folks to consult. It's a never-ending sort of hopefully positive spiral of improvement
Yes,
and getting more people. So
always the goal.
very inspirational. All right, so I'm gonna move on to one of our other panelists now for a moment. We'll have time for general questions later, so Derrick will be back, but I'm also going to talk to Jono right now, ask a few questions, because he's actually created a digital intervention. So I want to hear what that's experience like and how it's worked out for him. So Jono, I wonder if you could tell us a little bit about your background and what kind of got you into the place of creating your own digital intervention.
Hi, everyone, and thanks, Kevin and Jose and Derrick, for the invitation. I describe myself as a reluctant founder. I felt like I've been forced into doing this because of the fact that when I look around and see what digital solutions are available for young queer people living in places where it is not just difficult, but sometimes even illegal to be different, I'm just disappointed by what is there, by what does exist. And to go back to what Derrick was saying about the importance of relatable role models, I'm talking to young queer people in Nigeria, Zimbabwe, and South Africa all the time about the fact that, yes, they are following queer people on TikTok in the US, and they are drawing some inspiration from those role models, but there's a limit. Because their lives seem so different and so far away that you can't possibly imagine what your own path to that kind of life would look like. And that's part of the kind of frustration that motivated me to found SameSame. When I was growing up in South Africa, in my early teens, trying to figure out my sexuality, I was very lucky. I was very privileged. My parents had a desktop computer at home with a modem. And when they left the house and I was feeling very brave, kind of like close the curtains, lock the door, I would go online and I found forums and blogs that helped me feel a little bit less alone and helped me make sense of the world. And that was like really important for my sense of identity and my mental health. And this is borne out in all of the research that the Trevor Project produces. But because I am also from South Africa and acutely aware of the way that systems can create inequalities that make the experience I had inaccessible to the majority of my fellow citizens. So I had a desktop computer. Most young South Africans don't. Most young South Africans now have entry-level smartphones, and they don't have access to high-speed internet, and they don't have the budgets that allow them to consume anything they want to online. Every bit, every byte that they download is costing them money. And also, while I'm very, while I've personally gotten a lot from projects like the It Gets Better project, telling a kid living in a slum in South Africa in an extremely conservative environment that all you need to do is come out and things are going to get better, that's really irresponsible advice, depending. So I thought it was necessary for somebody to find ways of producing culturally relevant content for young queer people in different parts of Africa. And that was essential because the legal environment in these countries adds additional barriers to accessing mental health care. And there just aren't nearly enough trained mental health workers of any kind. I mean, that's true for the US too. But in Malawi, at one point, there was only one psychiatrist for the whole country. So, you look at most of these contexts and there aren't enough mental health professionals. The ones that you do meet are not likely to be affirming in any way. And you risk exposing yourself to persecution or prosecution by the state if you go to a therapist and you say, hey, I'm not really sure about my gender or my sexuality. And I just assumed that local LGBTQI plus organizations who do fantastic work would at some point do something, take advantage of the digital opportunity. But in chatting to them, I found that they are consumed by other concerns. I need to find a bed for someone to sleep in right now. I need to talk a young person down off of a metaphorical cliff. I am desperately trying to find a way to talk to a parliamentarian about getting a proposed bill quashed. And there weren't a lot of people who were thinking about the digital opportunity. And I had personal experience of being the beneficiary of a really profound digital experience. So I found myself, after several decades of working with digital technologies for different communities, eventually deciding, and this was COVID prompted, COVID happens, lockdown, you look at your life, you look at your choices. I thought, something needs to exist. And I guess it's going to have to be me doing it. And I'm not doing it alone. Of course, there are lots of other people doing it. And that's part of the journey as well, realizing that it will take many of us trying and failing and trying again to make a difference. But I just decided to throw my hat into the ring.
Amazing. I really appreciate that. And you've mentioned this a little bit in your answer already, but I wanted to talk to you a little bit, like, who are the users of SameSame and why is a digital solution the right option for them?
To date, we've had over 220,000 young people between 18 and 24 engage with our WhatsApp chatbot in South Africa and in Zimbabwe. We're we've created a service which is meant to be inclusive of all LGBTQI plus identities, but over time, we hope to develop more tailored versions of this self-guided cognitive behavioral therapy course, which our users access. We're still in the process, actually, Kevin, of trying to figure out where we fit into the broader ecosystem of support services for LGBTQI plus young people. In that, it's difficult for us to know, because we're very careful about what data we collect from our users, like who is accessing other services, what services, at what point are they ready to access those other services. Our contention is that the mental health ecosystem for queer youth, especially in these countries, must include digital components, because there are going to be some young people who would prefer a digital engagement that is private and anonymous. At least 50% of the young people that we interview in our qualitative interviews tell us that they prefer the fact that they're talking to a bot through our service rather than a real human being, because they're not afraid of being judged. So, we have a range of different personas of our service based on the data that we've collected so far. We're still trying to learn. But one persona is a young person who does not feel comfortable reaching out to a real person, who does not feel comfortable accessing a mental health service or a health service of any kind in their community, or who may not have the option to do so. And then there are other people who maybe do have that option, but need additional complementary or supplementary support. One of the things which we've heard from the counselors who work at the LGBTQI plus organizations we partner with is that they are overwhelmed and they can't support all the young people that come to them. And they also want services to offer them in between their sessions, because the counselors themselves are under strain and they can't take calls at 4 a.m. in the morning, which is often when young people are having a crisis.
That's amazing. I love that the reference to the data. We're very data-inspired people here at Eidos. It's great to see that you've done your homework and know a lot about your users and their need. And also understanding that this is going to fit into an ecosystem someday. It's not going to be the one-size solution for everyone. I am curious if you could just share, are there any sort of preliminary encouraging outcomes, positives you've seen with your users based on the work you've done so far?
So we use the PHQ to measure shifts in the severity of symptoms of depression, and we provide users with the option to complete the PHQ before they start the self-guided cognitive behavioral therapy course and afterwards. There have been many, many different versions of our bot. The latest version of our bot, which is about version 11 now, in Zimbabwe in December, we saw that 86% of the users who were completing the baseline and endline were showing a positive shift in their PHQ scores. 45.7% of them were showing a shift of 5 points or more, which is what we're aiming for with our work. We are seeing very significant challenges with completion rates of the cognitive behavioral therapy course, though. And that is strange to us, considering, what we are seeing in the data at the moment is a little bit of a mismatch between the qualitative feedback that we're getting from users, which is extremely positive and is able to describe in a lot of detail what's changed in their life, and some of the quantitative feedback that we're getting from the PHQ and some other questions that we're asking. And it is making us question the applicability of the PHQ for this audience in these places, and whether or not we need to be expanding the range of tools that we're using to measure improvements, and be thinking about different kinds of tools. At the moment, donors, our funders, they want the standardized clinical tools, but they don't seem to be perfectly capturing the changes that we believe are happening based on the qualitative feedback we're getting.
That's amazing. And I will say, friends, I'm sensing a theme of continuous improvement among our panelists today, right? Having an offering, collecting data, making sure it's working, and seeing how it can work better in the future. So I'm going to trace this theme and track it as we move on. We're going to hear more from Joan in a little bit, but now I want to talk a little bit to my employee, Jose, who apparently works for me most days. So Jose, we've heard a little bit from Derrick about sort of the research aspect of digital interventions. We've heard from Jono, who is working on creating one of his own. What I'm curious to hear from you is, in a lot of your research, you have worked with digital interventions. And for the folks on this call today who are kind of thinking about entering this world or just entering it now, what are the things you learned along the way as you were kind of entering the field of digital interventions?
I think some of them both Derrick and Jono have hit on. So it will sound a little repetitive, but that's probably a good thing for our conversation. Um, I think the first thing that we learned early on was the importance of youth voice for a lot of the programs we were building. Thinking about human-centered design, user-centered design, being willing to get really harsh feedback that you're building something that I don't want, right? So in one of our first programs, we had these grandiose ideas to build an HIV prevention program for young queer men who were wanting to meet partners online. And very early on, both in qualitative interviews, but also in the prototyping phase of the program, they were like, can we stop talking about condoms and HIV testing? We can get that information. What we really need to understand is like how to date. Like, how do I understand my body? How do I understand consent? How do I understand my feelings? How do I differentiate a hookup from a friend with benefits? And that was a completely different way to have to reimagine the content to not be about sex education, but actually about life skills. It was around shifting the content to actually be culturally relevant and developmentally appropriate for the folks we wanted to build. And so that requires you to then start small and then converge and reiterate and test and try again. I think we had like multiple versions similar to Jono's point before we did our clinical trial. I think the other thing that I increasingly encourage people to think about before they go build a tool is to set some internal team standards around data and privacy. So what is important to know from a user so that you can tailor the information to them, but also what are the channels by which that information is going to flow? So there's a lot of open source software out there that you can use to kind of plug and play a program, a website, a chatbot, but knowing how users' data is going to be potentially used or misused is important increasingly. And so reaching out and collaborating with both folks on the legal side, on the technical side, and on the community side around that intersection of data and privacy is super important. And lastly, I think we take for granted access. And so to Jono's point around accessibility, I think designing towards low technological barrier to make sure that folks who have different data plans can access it, who may have older devices can access it, while also thinking about access from a human-centered design space, right? Making sure that it's accessible, the wording, the activities you're asking people to do are accessible and engaging.
Amazing. And it is, again, that hearing that theme of continuous improvement, talking to users, thinking about your users, understanding their actual needs, and digital interventions being able to pivot maybe a little easier than some other ones. So some themes are emerging in our conversation already. I do have another question about sort of, you in your presentation talked about the ability of digital interventions to address things like awareness, accountability, motivation drivers. And again, for people here who are considering taking the pledge of creating their first or in an early stage of using a digital intervention, are there any particular tools or approaches you kind of recommend that kind of address that awareness, accountability, motivation issue?
That's a really great question. So I would definitely champion the inclusion of voices like from the community in all stages of the process. If you have a little bit of money or you can get your hands on a little bit of money, please make sure that those voices are remunerated for their work. It's not free advice, it's technical expertise that they are providing. And that I think ultimately will have dividends on the impact that you're doing and might actually even lower costs because you're designing towards something that people actually will end up using. So to me, that's really important that we're paying for the input of folks from the community. I think the other thing is sitting down and mapping out what it is that you want your program to do. And that's where human-centered design is so helpful. But more than that, how are you going to track it? And so we have several people in our team who really thinks about paradata and engagement data and understanding how do we keep people coming back to the program, stay longer in a particular section, revisit their answers as opposed to kind of clicking out because there is so much um, noise coming at us virtually. You might be really interested in Jono's program and you're in the middle of a chatbot session and then a friend texts you and you screen out or you get a Grinder notification.
Jose, that is exactly what happens. It's exactly what happens.
And so being able to like have data to understand those moments where you're losing folks or retaining folks is helpful to then think about scale and creating new nudges to bring them back or keep them completing what you're trying to achieve.
So you mentioned human-centered design a few times there. I couldn't help but link the Eidos guide to human-centered design. I'm sorry, everyone. But this might be useful for some of you, again, who are in the early stages of thinking about a digital intervention or want to kind of evaluate one you've already using. This might, or hopefully will give you some exercises to do some of that thinking ahead of time. So sorry for that shameless plug, everyone, but maybe it'll help. I do want to move forward to some kind of general questions for all of our panelists to answer now that we know about some of their specific backgrounds. These come from the questions that our audience members sent when they registered, so I tried to find some trends. And probably unsurprisingly for us, the biggest trend I found in the questions were questions about how to react to the most recent presidential election in the US. So I wanted to pose to the three of you, given the sort of policies and rhetoric from the Trump administration, what strengths and strategies can LGBTQ plus communities and allies employ to advocate for and ensure continuation of essential health services now that he has come into office? And I want to acknowledge first there will be no perfect answer to this, and this is something that we're all kind of thinking about together as a group. So I think our audience is interested to hear what are some of your initial thoughts about this and what do you see on the horizon?
I'll start so that my colleagues can say something smarter. I think there's a lot of fear right now, rightfully so, and concern, rightfully so. But we have done this before, and so that is not meant to be comfort, but rather to kind of just help us remind each other there's power in the work we've done in the past. We just have to activate it again. On the Eidos side, I will say that if folks need our help, we are happy to help and cultivate some of these relationships. But organizing, I think, is the most important part right now. And I don't think a global organizational map for policy advocacy work may be the only solution. I think some kind of local neighborhood level organizing and support building is important, whether it be a digital neighborhood or an in-person neighborhood.
Yeah, I guess I have some thoughts. Um, I mean the first one, and like I hate to sound all like hokey about it, but I think it's like we need to kind of calm down, take a deep breath, and like literally take care of ourselves. I think it's very easy, unfortunately, to sort of just kind of spiral. Understandably, I mean, I think it's just even keeping up with the news itself has been overwhelming, to say the least. But I think it's, about having faith in kind of each other that, even if I have to mute the notifications on my phone today, that like others, right, in kind of movement and coalition will kind of, make sure that, like it's okay if I missed like a breaking news alert, like someone else will kind of, kind of pick up the slack there. So I think kind of giving ourselves some grace, first of all. Um, secondly, there's a lot of things I keep hearing around, and I don't know, I have no idea if they will be effective or not. I think one of the things that I frequently hear is around kind of like, oh, we should use these words or not these words anymore, right? And things. And I will never, I think, dissuade anyone from doing anything that feels like it might kind of protect them or the organization or their kind of clients, or patients. But I also think we might want to maybe kind of not kid ourselves into thinking how effective that might be. So I think, an OPM memo even went out like last night or this morning, and I mean they explicitly cited an awareness of this, right? And so uh, yeah. So I think we just have to kind of be careful about some of the strategies we've used in the past, and they might have limited utility this time around. I think it's also important just to like check in with kind of especially federal employees to see kind of and understand their understanding of things, right? I think that's really probably where we have a better understanding of what's going on rather than like, filtered through kind of what we often will read online. Um, and then I think another thing, and this has been very interesting for me at Trevor, is this is obviously kind of turning into a very ridiculous kind of political, um, just this has been designed to kind of score political points with folks and these attacks, and a lot of us are in organizations where we are right clearly prohibited from kind of engaging in kind of a lot of political activity. But I think we have to be careful about what does that mean and what does getting involved mean. And I think part of it means is we have to be aggressively depoliticizing the lives of LGBTQ plus people, right? Like we did not politicize kind of our existence, other people did. And I think we have to be mindful that we can sort of be apolitical, but also like aggressively standing up for and advocating for folks. And I know that can be like a thin line to walk, but I think sort of sitting back and saying nothing is not really an option either. And then like, Jose said, I think we have to really, we always talk about making coalition with other folks, but like we got to actually do it, this time. So like folks engaged in reproductive justice and racial justice and economic, et cetera. Like we are all in this together, right? And we will definitely kind of, I think sink or swim together there. Um, yeah, I mean, I have, more thoughts kind of as every time I get a news alert, but I think those are kind of the ones for now that have sort of floated up to the top of my head in this moment.
No, it's very helpful. And I agree to hear you kind of think about those things. I think, again, for the questions from our audience, I think that's very much on their minds and piecing it through. So that was a lot of useful advice there. Jono, I know we talked about this a little before, and you kind of have a not just American, but global perspective on some of this as well.
Yeah, I guess one encouraging thing to say is that it's not all doom and gloom. Today, for example, for the first time ever, same-sex couples in Thailand can get married. So there has been legislative progress there. Namibia recently decriminalized sodomy thanks to some very resourceful activists in that country. And so just as things are getting a little darker and more bleak in places like Uganda and Ghana and potentially the US, there are other communities in other places that are forging a different path. And that's a reminder to me, that there are going to be setbacks, that we should expect that, but that doesn't mean that there won't still be victories to come. Hopefully, some of them in the near future. I did just want to talk about the comment that Lau Gising left here. I don't know if I'm pronouncing your name correctly, because one of the interesting things that I've been hearing from activists in different parts of Africa is that there needs to be much more of an investment in building economic power amongst queer communities. There's a group of queer activists in Uganda who have this plan to buy a pork farm and to produce the best pork in the country as a way of, creating a monopoly on a highly prized foodstuff. Oh, you want the best pork in Uganda? Guess what? You're gonna have to pay the gays to get the pork. And I think that's just because they've seen a lot of political back and forth to them, which has left them feeling that there's a limit to what they can achieve politically without advances in other areas. And more, and this is especially true for countries where, there are there's a much larger percentage of the population who are struggling with poverty and unemployment, particularly young people, that there's a feeling like there is some like there's some basic fundamentals that need to be in place for us to be successful politically. Of course, one can't come before the other. They need to happen at the same time. And this is where I also think mental health comes into play. Like, I have a lot of, I wouldn't say fights, but I'll have conversations with people who say like, we need to provide mental health support to queer young people in these countries, and they'll say, well, really, you should just focus on changing the laws, because until you change the laws, it doesn't matter if you're providing mental health support. And like, how is a young activist supposed to get out of bed if they don't have the mental resources to do that? Like, you can't separate them from each other. So I think it's about looking at the fight more holistically and thinking, how do we advance our like health equity and economic equity alongside political equity?
Amazing. I was actually at a presentation recently where the speaker said, sometimes we can be distracted so much by queer rights, we forget queer lives, the actual experience people actually have on the daily. And I think that's a great reminder of that as well. I'm going to my next question, and I'm going to start with you, Don. I'm going to give you warning. I'm going to ask you to react to this one first. If the number one trend was questions about Trump, the second trending questions was questions about AI. AI is in the news everywhere at the moment. Donna, you already talked a little bit about who your users wish to be talking with, maybe preferring a bot to a real person. But I'm curious, do you see creative ways that digital mental health can use AI? Is it helpful in some ways? But also, do you see any initial red flags or things to be concerned about as AI seems to be launching everywhere? And I apologize, Donna, but I'm going to ask you to react first, if you don't mind.
No, one thing I'll say is when ChatGPT launched, and especially when Meta made their AI available through WhatsApp and Instagram and Facebook, we thought that our bot would become redundant overnight. And we've actually conducted a lot of interviews with young people in Zimbabwe and South Africa about their use of AI now. And the vast majority of our users, in places that people don't necessarily think of as very technologically sophisticated, have interacted with AI thanks to Meta. And what they found is that it does not provide them with everything that they need. They find it very useful, but most of the young people that we spoke to had examples of where they'd asked the AI something and gotten an answer back that they knew to be incorrect. So there isn't this like blanket acceptance of everything that an AI provides. And we actually had young people go through our bot and the AI and then like score them based on relatability and relevance and trustworthiness. And we found that in some areas, our bot performed better, well enough to give us confidence that we should keep on doing this. Which isn't to say that the AI offerings that exist now won't become better, but right now what young people are telling us, they're not getting what they need from it. And one of the things which we've been careful to do is distinguish between kind of how we might use AI to create a therapeutic experience for young people, which is not what we're trying to do. We're not trying to recreate the experience you would have with a counselor using AI. There may be great applications for that, but that's not what we're doing. What we're trying to do is take AI and use it to make our like very structured cognitive behavioral therapy course more engaging, going back to what Jose was saying about engagement being a big challenge. So it's like very tightly scripted. It's not a free-form conversation. It's a conversation about something very specific with the bot given clear instructions and monitored by people as well. At the same time, you need like kind of the right mix of people and machines to make the system scalable and safe, we think. I'm not saying we don't have the right, I don't know if we have the right mix, but that's our sense, is that like they both need to be in place. There does need to be a human in the loop, and we need to find the right balance between the human and the AI. I've got lots of other things to say, but I know other panelists do.
No, Derrick, I assume that a lot of people are suggesting ways of trying to get Trevor Project to jump on the AI train. I'm curious, I could be wrong, so feel free to correct me, but what does that look like on your end?
Oh my gosh, we probably get like 10 emails a day asking, hey, can you give us your data and put it in, some AI thing, and I don't know, and I feel like I feel like such a laggard around this, but I mean, I think there's a lot of potential, right, for kind of AI to help us do things. For me, I think my general philosophy around AI is if it frees up capacity for like people to do people things, then I'm sort of willing to entertain it. Um, I think where I'm right now, sort of having a challenge is, there's just there's already, I think, trust and issues around data privacy and access. And I think right now, AI is sort of just this big unknown. Like, okay, look, so what happens when we sort of feed it data, right, on kind of queer people? Like, you don't get it back. Like that's like impossible. You can't like unlearn the thing. And so I think we have to really think of like systems and regulations and assurances in place that I just don't think exist right now. And I think again, this particular moment, like folks are really scared. I mean, right now on social media, there's a lot of stuff going around telling people like do not participate in like federally funded research, right? If you're a queer person. And so that is the level of, I think, understandable sort of fear and uncertainty around providing data. And I think, and so again, just putting this into kind of AI, I think we're not there yet. And I think if we want to move in that direction, I think we are not nearly as close from a kind of ethics perspective as I think folks want to think we are.
Helpful to think, promising, but not there yet, maybe. Jose, I'm also curious from you in terms of like studies you're seeing, studies people are asking you to comment on, react with. Do you see any sort of trends in sort of AI and how it might relate to digital mental health?
Yeah, I share both of the panelists' perspectives. I think we're getting to a place where this resembles like when my mom calls me and says, I can't seem to log into the internet. And I have to like unpack with her on the phone, like what in the internet? Is it an app? Is it your email? Is it a website? Is it a transaction? And I think AI has become this kind of catch-all currently that I think we all need to start kind of creating heuristics for each other around to Jonna's point, like what are we trying to solve for? And then um, I would love, and I haven't seen a really good one yet, but maybe folks in the audience do, like a tip sheet of like quality indicators of, yeah, it's okay to use this particular AI system, or if you're in the venture capital space, like these are the things that you should be thinking about as a founder if you're going to collaborate with somebody on an algorithm or a language model or whatever else. So um, I do worry about the erosion of science, so I will say that AI is only as good as the data we feed it. And if we don't continue to support the rigor and the reproducibility that we want out of science, then we are going to have biased models. Um, so we have work to do in this climate.
We've got work to do, yes. Another theme and trend, I think, to come out of our conversation today. Still plenty to be done, answers in progress. So we're coming up to the hour, so I actually want to move us to the final section of our presentation today. As I mentioned earlier, we like to end these with breakout rooms. So for all of you who go to these sort of events in real life, there's that part at the end of the presentation where people charge to the front of the stage to get one more question or make a connection with the panelists, and we'd like to try to simulate that virtually. So in just a moment, not yet, but in just a moment, I'm going to put links into the chat. Each one of our panelists will have their own breakout room, and you'll be able to click on whichever panelist you like. When you click on that link, it'll ask you, do you want to leave this webinar? And the answer, unfortunately, will be yes. So we're going to wrap it up here. I do thank all of our audience members for your questions, for your participation in the chat. I saw some really great conversations going on in there. I would like to thank our panelists before I send you an email later saying thank you for your time, for your openness, for your vulnerability. I think those conversation was really helpful for a lot of folks.